vaccine drive, 100 crore doses, 1 billion doses being administered in a record 275 days. You are going to be seeing programs planned across the country, dedicating it to the vaccine workers, the healthcare workers, our COVID warriors. Joining us is one of them today, the big boss of Fortis, Dr. Raghuvanshi. Dr. Raghuvanshi, this is Nayanthara. Thank you so much for taking the time out and joining us live here on ET Now. If I could just begin by getting your first reaction. This is, it's nothing short of a miracle.
Thank you, Nayanthara, for having me on this wonderful historic occasion. It's a great, great achievement. It's a mega milestone which we have achieved. And I think this is a shining example of how various stakeholders can come together for a critical national agenda.
Oh, absolutely. We have 10 crore Indians that still need their second dose. The vaccination drive for children, there's a roadmap that is out for there as well. We couldn't have had a better Diwali. There's no third wave. You tell us, have we hit herd immunity?
I don't know that, to be honest. The answer is it depends on many factors, whether the virus is going to mutate, if there are going to be any new strains, etc. But all the signs indicate that for the present moment, the disease has ebbed and there are numbers are coming down all across the country. There are hardly any new cases getting reported now compared to what we saw on the peak. So my feeling is that the immunity is developing as the herd immunity is developing, and the disease is likely to be more endemic in nature going from this point onwards.
That is something I think a lot of us are hoping, Dr. Raghuvanshi, but there is still, and this is clearly a mega milestone like you suggested, but there is still work to be done, wouldn't you say? How do you think we should approach the people that we haven't managed to vaccinate yet? And I don't think it's just our country that's dealing with it. Children still need to be addressed. Do you think that's a pressure point? That's a cause of worry?
No, absolutely. Children's vaccination is an extremely important part. As the vaccination gets approved for the use in pediatric population, I think that rollout will also happen. And India has already demonstrated on multiple occasions, not only this, that we have a very robust vaccine delivery mechanism in this country. And I think this is a moment to take a pause and salute our public healthcare system, which is continuously under criticism, that it has been able to deliver almost single-handedly something which was considered impossible 275 days back. Most people were calculating the number of doses available and thought that this may not be a goal which is too lofty and may not be achieved. So I think by December, we should see that all the adults should receive the second dose as was originally planned. And the children's vaccination also should begin because it is in final stages of clinical approval for pediatric use. Once that happens, that would be a great step forward. Having said that, I also believe that a lot of children had got asymptomatic disease earlier on. So the immunity levels, even in children, are relatively high. And that has been demonstrated in some of the sero surveys which have been conducted.
Now, Doctor, the sheer size of this is incredible, right? The latest data suggests the USA, obviously much lower population, but 40.8 crore doses, more than double that is what we've achieved. But I'm just thinking going forward, we'll have to use this infrastructure for a while longer, wouldn't you think? Booster doses will have to be looked at, assuming, of course, that the third wave does not become as big a problem as a second. How do you see this panning out over the next, say, 6 months or so?
Yeah, you're absolutely right. This infrastructure will have to be used further. Booster doses is one of the areas which where it may go. But if the disease becomes endemic, maybe the vaccination will become a kind of a regular process as well. But what this has also done is that, the like, for example, the COVID platform that has demonstrated the power of technology and how the nation's health can be managed in a good way. So I think this is also a good segue into the our digital health mission, which the honorable PM has already announced and is being rolled out. So the power of that will also get unleashed over a period of time. So there has been a silver lining in this dark cloud. So even if the third peak had to happen, it will probably be milder, simply because larger number of people have immunity, and the strains are now causing milder form of disease. Newer therapies and protocols are available, so the hospitalizations have become less. So I believe that all the factors point out that the third wave, even if it was to happen, it would be much more manageable. And that is what I think is a good thing. And the experiences and the learnings from this whole experience are going to be helpful in the public health delivery for future as well.
So, Dr. Raghuvanshi, as we start coming to an end of this interview, it's such a big milestone. Like you're saying, the cases have really, really come down. And at the same time, we've learned from the second wave, right? So we've reopened more carefully, especially during the festive season. It's imperative we keep our masks on, we keep doing social distancing just to make sure that we don't have a Delta variant like situation, a Russia like situation, a Singapore like situation back in India in the form of a deadly third wave. But Dr. Raghuvanshi, any quick word right now as far as procuring more supplies go, or the roadmap for children?
Yes, so I think as soon as the vaccine is approved, that will be available for delivery. And I think for pediatric population, the mechanism is already in place because we have several programs of vaccination, public health programs. So that should not be a problem at all. Having said that, one of the major things which we all have to remember, all signs indicate towards a resolution of this issue over a period of time, but the COVID appropriate behavior and masking is something which we cannot give up till the time this is absolutely under control. And that would take 6 months, 1 year maybe.
Okay, 6 months to 1 year for that important milestone. But today, what a day it has turned out to be. We are, after this era is the best news we could have ever gotten, getting into the valley. We don't know if it's herd immunity, but the number of cases so abysmally small. There's been no third wave. 100 crore COVID-19 vaccines being administered. Only 10 crore need their second dose. It's working out beautifully, and hats off to all the healthcare workers, the vaccine workers who have done this in urban centers, but also the far-flung areas in rural India. Remember those images where we saw vaccines being carried by boat? With that, we're completely out of time. It's turning out to be, once again, a very action-packed day for the Lal Street. You're seeing the